How does sputum culture test for tuberculosis? Imagine trying to catch a tiny, slow-growing bacteria that hides deep inside your lungs. That's what a sputum culture test aims to do when diagnosing tuberculosis. The process starts with collecting samples of mucus that you cough up from deep inside your lungs. Usually, 3 samples are needed, taken over 3 days, with at least one early morning specimen because bacteria tend to be more concentrated then. To get a good sample, you'll be asked to cough deeply, not just spit saliva, to ensure the sample contains material from the lungs where the bacteria live. If coughing up sputum is difficult, doctors might use special techniques like inhaling a saline mist to loosen the mucus or perform a bronchoscopy, which involves inserting a thin tube into your lungs to collect the sample directly. Once the sputum is collected, it's placed into sterile containers and sent to a laboratory. There, technicians spread the sample on a special culture medium designed to support the growth of Mycobacterium tuberculosis, the bacteria that causes tuberculosis. The culture is then incubated at a controlled temperature, usually around 37 degrees Celsius, to encourage any bacteria present to multiply. Because tuberculosis bacteria grow very slowly, it can take between 6 to 8 weeks for enough bacteria to grow so that they can be detected. Some advanced methods can speed this process and give results within 24 hours, but these are not always available everywhere. During incubation, lab workers regularly check the cultures for signs of bacterial growth. They might use microscopes to look for bacteria directly or perform biochemical tests to confirm that the bacteria are indeed Mycobacterium tuberculosis. If bacteria are found, it confirms an active tuberculosis infection. If no bacteria grow after the incubation period, it suggests that the sample did not contain detectable bacteria at that time, but further testing might be needed if symptoms persist. This test is considered the gold standard for diagnosing tuberculosis because it directly detects the bacteria responsible for the disease. It also helps doctors determine which antibiotics will be most effective by testing the bacteria's susceptibility to different drugs. Importantly, the sputum culture test involves no risks to the patient beyond the initial sample collection, which is simply coughing up mucus. Overall, it provides definitive evidence of tuberculosis infection, guiding appropriate treatment plans, and helping prevent the spread of the disease. If you suspect you might have tuberculosis, it's essential to consult a healthcare professional who can recommend the right tests and interpret the results accurately.